Good morning, everyone. I can report 15 new cases overnight, 11 of them linked, and the remaining 4 still under early investigation. 5 of them were in quarantine for their entire infectious period. We're aware that at least 8 have spent part of their infectious period in the community, and the balance are under investigation. The number of people in hospital has increased a little to 9. We have 1 person in intensive care requiring ventilation. Testing numbers were down a little yesterday to a little over 2,500. So again, if you have any symptoms, if you've been in any of the exposure sites during the times outlined on the website, please come forward for testing. On vaccination, yesterday the ACT reached the 75% milestone for first doses of our population 12 years and over, and about 51.5% of the 12 plus population have now received 2 doses of a vaccine. Pleasingly, I can report that as of yesterday, just over 97% of staff working in residential aged care had received at least their first dose of a vaccine ahead of the implementation of the mandatory vaccine requirement. Yesterday I spoke about COVID business support grants. The ACT government has been able to work effectively with the Commonwealth Treasurer's Office to expand COVID business support grants and to create a new COVID-19 tourism accommodation provider, arts, events and hospitality grant. There will be an additional payment of ACT government COVID-19 business grants, an extension of a further $10,000 for all employing businesses and $3,750 for non-employing businesses. This will be paid to all businesses who are eligible for the business support grant in industries that are still significantly impacted by the health restrictions. There will be additional one-off top-up payments also made for larger ACT businesses with higher turnovers. We will be discussing additional extensions to the business support grant program with Treasurer Frydenberg at our scheduled checkpoint on the 1st of October. There is recognition from both the ACT government and the Commonwealth government that businesses in the tourism, accommodation, that's hotels and motels, arts, events and hospitality industries have been hit hard, not only by the current restrictions in the ACT, but before then by the lockdowns in New South Wales and Victoria and the border closures to the ACT from other states and territories. So reflecting these impacts, a further series of one-off grants for local businesses in those sectors, tourism, accommodation, arts, events and hospitality, will be available. The eligibility criteria for these additional business payments will be the same as the COVID business support grant. Today, the ACT government released details of a major community support package. This funding will ensure that those most in need will continue to receive support, and in many instances support will be increased significantly. This package includes funding to expand the capacity of existing community services to deliver specialist homelessness programs that commenced during the COVID-19 pandemic. It increases the rate of community sector indexation that is applied to the annual funding for all community sector organisations under this model. This will assist community sector organisations across the ACT to meet higher wage costs following the recent Fair Work Commission decision to increase the minimum wage across the nation and all award wages by 2.5%. The additional funding will strengthen legal aid's capacity to represent, support and assist vulnerable members of our community. And this includes, and this is very important, more frontline support for victims of family violence, the elderly and for vulnerable witnesses. There will be more support for vulnerable people in Canberra's multicultural communities, including the Refugee, Asylum Seeker and Humanitarian program that provides financial assistance for clients who hold an ACT Service Access Card, and for the support of the resettlement of refugees, asylum seekers and humanitarian entrants living in the ACT. This package of support also provides significant increases across a number of emergency relief areas, including emergency food relief for those in need. It follows a range of COVID-19 economic support measures that have been previously announced, which include increased funding for mental health, crisis and emergency support, extending the Jobs for Canberrans program, emergency food relief, and the government's decision to provide a $1,000 rebate for 31,000 Canberra households on their utilities bills, their electricity, water and sewage bills. Work is continuing on an additional mental health support package, which will be announced in coming days. And as I said yesterday, this is a stressful time for everyone. It is okay to put your hand up and say that you're not okay at the moment. There are support services available and more funding will be provided to those services. Please reach out for help if you need it. For those who've joined late, a quick recap: 15 new cases, 11 of them linked, only 5 in quarantine during their entire infectious period. The number in hospital has increased to 9 and we have 1 person in intensive care. I'll invite the Deputy Chief Health Officer, Dr Vanessa Johnston, to come forward and provide an update on cases and epidemiology. Following Dr Johnston's update, both myself, Dr Johnston, and the Minister for Health, Rachel Stephen-Smith, who will be joining us once the Assembly finishes its session, will be available for questions. Thank you very much.
Good morning. I'm Dr Vanessa Johnston, the Acting Chief Health Officer and the Deputy Chief Health Officer of the ACT. So the total cases for this outbreak now stands at 556, with 15 new COVID-19 cases notified since our last update. We continue to see people recovering, and our total number now of recovered cases is 315, so that's 17 more than yesterday. So our team continues to manage 241 active cases. So of the new cases today, I can confirm that out of the 15, 11 can be linked to known cases or ongoing clusters, and 4 remain under early investigation. Out of the 11 that are linked, we also know that 6 are household members at this stage. Of the 15, 5 were in quarantine during their entire infectious period. Out of the remaining 10, 8 spent some time in the community for at least part of their infectious period, and 2 remain under assessment at this time. To 8 o'clock last night, we had 9 people in our hospitals. 1 of these is in ICU and is being ventilated. Of the total 9, 4 are unvaccinated. 1 has received 1 dose. 2 are fully vaccinated, but that doesn't include the individual in ICU. And 1 is unknown. Our youngest patient in hospital is in their 30s and the oldest is in their 70s. We now have almost 1,000 self-identified close contacts and around 320 active exposure locations. We have no additional active public sites of transmission to announce this morning. 1 new case has been linked to Bidfood Canberra. 2 new cases have been linked to Busy Bees Childcare Centre, so these were known sites of transmission. All of these cases, all 3 of these cases, are household contacts of cases and therefore are not unexpected. So it's a short statement today, but before I finish, I'd like to remind people how important it is to continue to be COVID-19 safe. When in the community, potentially with those that are unknowingly infectious, wearing your mask correctly can be the difference between you becoming infected or not. It can also help protect your close contacts and your loved ones if you become unknowingly infected with the virus. Please visit the website for more information on all of our recommended COVID-19 safe behaviours, including how to wear your mask properly. As I know Dr. Coleman has said before, our response to the COVID-19 outbreak is broader than just a health response. So my shout out today is to the team of frontline workers from Transport Canberra and City Services who are continuing to undertake cleaning and urban maintenance tasks during this challenging time. From the early hours in the morning while people are still sleeping, we have city cleaners looking after our public places and crews that are filling potholes. Throughout the day, we have mowers keeping our grasses low and in check. Street sweepers are in action and crews undertaking tree maintenance. This is all really vital as we come into the hazard season in summer. So please give them a wave if you see them and thank them. Also understand that these teams have had to change their working arrangements, so please be patient as they look after our city in a COVID-safe way. Thank you.
Thank you, Vanessa. Happy to take any questions. Who'd like to step up first?
Happy to hear, Chief Minister.
Okay. Harry, yes. We're on this side of the room.
You've previously expressed your frustration about the wearing of masks. Have we seen any improvement in that, particularly when it comes to businesses?
The Access Canberra team report quite significant improvement, but still I think they've had to issue a small number of show cause notices to, I think, about 3 businesses, but I'll just get that number absolutely confirmed. So it's a very small minority who have been warned, and then inspectors have come back and found continued non-compliance.
You resigned to the fact, I guess someone else wants to ask a question there. Are you resigned to the fact that we'll see these continued levels of case numbers? We just don't seem to budge on those number of cases that are infectious while in the community. Are we going to continue to see that for some time, do you think?
Well, look, the indications are that the figures we announced today are the result of activity and people infectious in the community 4 or 5 days ago. So you sort of need to look at what happened then to get a bit of a sense of what will be announced in coming days. The variables that change that in terms of headline case numbers will often be the size of a household, that is where an infected person brings the virus back home and into that household. The days when it is lower, they are 2 or 3 people households generally. The days when it has been higher, we have had multiple larger households. And then you have circumstances where there might be a particular public exposure site that might crop up, and we've obviously discussed some of those examples. Under the current public health restrictions, we're not seeing the sorts of clusters of 50 or 60 that we saw earlier on in the outbreak associated with, for example, schools or nightclubs or some of those places. So the fact that we didn't go through a sort of a pattern of 1 case, 4 cases, 16 cases, 32 cases, 64, 128 and onwards is because the public health measures kicked in and have suppressed the spread, and we've seen our effective reproduction rate hover either slightly below or just above 1, which is why we're seeing this, I guess, stubborn number, often in the low teens. The things to look for, to be concerned about, are if we get numbers in the 20s or 30s. That's a problem. Equally, if we got a run of days that were low teens with even fewer infectious in the community, and we got that for 5 or 6 days in a row, that might start to see a really encouraging trend. What is impacting on those case numbers as each day goes by is the higher level of vaccination. So in terms of things that are bending the curve, It's a term that people have been using quite a bit, including a shout out to Casey Briggs at the ABC, who even has a segment, I think, on this. A major factor that is bending the curve for the ACT is the vaccination rate, but it's also the public health measures and its effective test, trace, isolate and quarantine measures.
Given the trajectory of the outbreak, is the ACT on track to contain COVID-19 in the community before reaching Phase B in the national plan and therefore easing restrictions before then?
I guess it would depend on how you would define containing. I think you could mount an argument at the moment that we are containing. We're not seeing exponential growth, but if by the question you mean that we could have everything back to zero by the 15th of October, I wouldn't make that bold a prediction at this point. What we have seen, though, is that the measures are being effective in not seeing a spiralling of case numbers, into the 40s, the 60s, the 80s, and over 100 a day, which would be if we'd followed Sydney's trajectory, that's what you would have seen. So the measures are being effective, and the three measures, I repeat, vaccination, the public health, social measures, the restrictions, and the testing, tracing, isolating and quarantining at keeping that effective reproduction rate at or around 1, which means you see this very low level of infection. It's been difficult because the Delta variant is a very transmissible variant of the virus, so it's been incredibly difficult to get those numbers below that, but equally we have not seen our case numbers explode exponentially, which would have been the case if we didn't have the public health measures in place. And that pathway we've seen in Sydney. We could have been in that situation if we had adopted similar policies in response. We didn't, and so we are in a better position as a result. I mean, I note Sydney is in it's been locked down for, coming up on 3 months, and longer, in fact, I think, and has had an extraordinarily high caseload, hospitals absolutely bursting at the seams with very sick people and hundreds of deaths. We have not seen that in Canberra, and the principal reason for that is the public health measures that we've put in place.
The risk of transmission in the outdoors is fairly low compared to the mental health risk of, I suppose, locking families up inside for the school holidays. So given that, why haven't we been given more freedom to spend time outdoors in the next few weeks?
The advice from the Chief Health Officer was very clear about ensuring that in this period, which is still a very high risk period, we didn't have a lot of movement within the community. And so we are still at a very challenging part of the outbreak. Our vaccination rates are not yet high enough to allow a significant increase in movement. But of course we have already moved on a couple of occasions in terms of increasing time and increasing the range of outdoor activities, and that clearly is a logical next step. We've already foreshadowed in the context of where we can go next in easing restrictions, that as you've correctly observed, outdoor activities are safer, but large gatherings of people outdoors are still risky. So we need to remind people that even outdoors, the virus can still transmit, particularly if you are in close proximity to other people, and if you're not wearing a mask, then the risk is significantly higher. So right now, we're just adopting a cautious position because we don't want to see an exponential increase in cases because our vaccination rates are not high enough.
Any plans to open national parks?
Well, look, that question has been asked and is on the list of things that would be considered in future restriction easing. Again, one of the challenges is we would not want 10,000 Canberrans to go to Tidbinbilla all at once. So we just need to manage some of these issues in terms of movement of people. But on the risk spectrum of activities that could be allowed in a next easing or a future easing of restrictions, that would be one that would be high on that list.
Chief Minister, business in particular is pretty upset that we're not going to match New South Wales opening roadmap, pathway, whatever. Are you alarmed that New South Wales is becoming a pace setter, and that it's setting a pace that can't really deliver, or is raising expectations beyond what we're able to deliver?
Well, look, I think, again, there's a disconnect between what the New South Wales government are actually saying and the detail, and then how that is being reported in the media. New South Wales have so heavily caveated almost everything that they've said, but none of the caveats are reported. It's just the headline information, and yet they are very clear about, this can only happen in these certain circumstances. And in some instances, they just haven't yet finalised details. So we still don't know how their proposed approach on only allowing vaccinated people to do certain things will actually work in practice, how it would be policed, and what the implications would be. Now, the information they have provided has suggested that certain essential services would still be accessible for unvaccinated people. So unvaccinated people could still go to the supermarket, for example, that they wouldn't be seeking to introduce discrimination in that regard. But if they apply their only vaccinated people can go to businesses that are not on their essential services list, you're going to get some very odd anomalies in New South Wales, where unvaccinated people could go to Bunnings, for example, but couldn't go to Big W. So there's a range of very, very challenging implementation issues, even setting aside the human rights questions that are raised here, and then whether in fact there will be people in New South Wales who won't have even had the opportunity to get vaccinated. I wonder what their settings are going to be for cafes and restaurants for families, when there'll be some members of the family who will have been vaccinated and others who will not have. Does that mean that the family can't go out together? That's going to be another question that they'll need to resolve. Now, they have given no answers on those sorts of levels of detail, which I'm sure they'll be asked repeatedly in the lead up to that, to that time frame. They've not given a date for this. They've sort of given an indicative time frame and haven't really fleshed out much of the implementation detail. Now, look, they've got away with a few headlines to say that they're doing all these wonderful things, and none of the caveats and none of the detail have really been picked up in either the community discussion or the media discussion. I think that's going to happen, though, because, having seen a couple of the press conferences, that's now where journalists are focusing on and wanting the detail, wanting to know, for example, if the vaccination discrimination is going to become a permanent feature of life in New South Wales, or it's just in the transition phase between 70 and 80%, or is it beyond that? And then on one day, the Deputy Premier said it would stop at 80%, wouldn't be needed anymore. And then the Premier came on 15 minutes later and said the Deputy Premier was incorrect on that. They hadn't yet made a decision on what would happen at 80%. And that was reinforced yesterday by the Premier's press conference. So I guess there's a lot of unanswered questions. Now, I understand it is very difficult to answer every question. I'm now, 35 press conferences in a row, and have taken hundreds of questions from this podium, and I can't answer in detail every single question. So I'm not criticising the New South Wales government for not being able to answer every single question of detail, but what I am concerned about is a perception that there's this magic nirvana that's going to happen in New South Wales in 4 weeks' time that the lived reality will not match up to. Then we can come back, yes.
Thank you.
Yep, terrific. Yes, so I will be back.
Thank you.
Thanks, Deputy Chief Health Officer. Just wondering if we could get a bit of info about the detainee who has tested positive just when they were found to be positive and when they were picked up?
So currently, my understanding, I'm just going to check, is that there are 2 people in the AMC that are currently positive. So one case was detected through routine testing upon admission, and another positive case that was positive before admission. So these are the only 2 that are connected to the AMC. I don't have the exact dates of that screening, and all the days and weeks are blurring together. But I think the really positive news is that screening's working. So now that's been implemented across all new admissions. Previously, we were just working with corrections on people that had risk factors or that had travelled interstate. Now, in the context of community transmission, that's gone across the board, and people are also being tested in the watch house. So everything just worked really well in that instance. Corrections handled it beautifully with the assistance of Justice Health. And then in the other case, that was a known case before they went in. So all of the appropriate measures were taken.
So this case was picked up at the AMC, is that right, at testing there?
Yeah, on admission screening.
And not linked to the previous case?
No, they're not linked.
I'm hoping you might shed a little bit of light on how exactly the virus is spreading. We're seeing a fair chunk of people infectious in the community, but we haven't seen anybody fined. Are they all unknowingly infectious? Are people not isolating when their household members fall sick? Or
Yeah, so I'm not the person to talk about enforcement activities, but I know police are certainly undertaking a range of enforcement activities. So I'm not sure that it's correct to say that no one has been fined. And I'm sure the CPO would be happy to give an update on that. We're certainly working closely with police if we become aware of people that are breaching public health directions to either isolate or quarantine. So it's, as we've said before, it is a range of factors. It's people, we take a very conservative approach when we talk about being infectious in community. So we take a hard line that you're either in quarantine, and that's not just under stay-at-home orders like the rest of us are under, but actually quarantine. That's when you're zero risk to the community. And then there's a gradation of risk around whether you just popped out to the supermarket and did a quick shop, but we still count that as infectious in community if that was at a period of time that you were actually infectious. Then there are those that attend essential work, and some of those are over quite long shifts or on multiple days. And in the vast majority, they're all unknowingly infectious. And then there are individuals that are struggling to quarantine and isolate at home for a range of factors. Some of that might be related to mental health, alcohol and other drug use, substance issues. And so we're working really closely with Community Services Directorate and ACT policing on those matters and moving people where we can to our government-managed quarantine facility.
have identified people who have knowingly been infectious and been out in the community?
Yeah, certainly as in Victoria and in New South Wales, when you see such large case numbers and also such large numbers of people that are in quarantine, there are going to be people that in the main it's because of other vulnerabilities that they're going to struggle to remain in quarantine or isolation. That's to be expected. We take a very educative approach and wraparound support approach in the first instance, but then police will step in where they need to, as they did the other day with the individual who was transferred to AMC.
With the vaccination rates, are they likely to accelerate so that the projections that we're working on now are likely to change even day by day? Is that a movable feast, really?
Look, it is a movable feast in terms of the supply of the mRNA vaccines, so both Moderna and going into pharmacies as part of the Commonwealth vaccination program, but also the rapid uptick in the supply of Pfizer vaccines to GPs and also to government clinics. So while the Commonwealth and all states and jurisdictions can make projections on when they might meet the 70% and 80% thresholds. There are a lot of caveats around that. At the moment, in the ACT, we're still constrained by supply. But that's going to change, and that's going to see the whole nation push forward very quickly to reach those thresholds.
On AstraZeneca, are we seeing a big take-up in the ACT with AstraZeneca? People just deciding they'll just go and get the AstraZeneca and not worry about others?
Yeah, look, I can't today speak specifically on whether we're seeing in the data people wanting to wait for an mRNA vaccine. When I asked the team about it a couple of weeks ago, that wasn't coming through. So people that were eligible for AstraZeneca were getting it. It's certainly our advice that the best vaccine is the vaccine you can get today. And certainly if you've had dose 1 AstraZeneca, then we would absolutely advise you to complete that course of vaccine. It's very safe, and it's only in those very rare instances of having a major allergic reaction or a very rare thrombotic event in dose 1 that you'd use a different vaccine. So I think there is a lot of AstraZeneca around. You could go today to get AstraZeneca at a pharmacy or a GP, or indeed one of our clinics. So I just urge people to think about what vaccine they'd like to access today, and think about AstraZeneca and having that conversation with their healthcare provider.
And just on a bit of clarity around restrictions for businesses, some larger businesses with plenty of land, if there are several generations or one generation of a family living on a property which doubles as their business, say like a warehouse, are they allowed to all work in the warehouse, given that they're it's on their private property really, but it is commercial?
To the best of my knowledge, and I'll be corrected after this if I get it wrong. But if everyone is in the household and they're otherwise always living together, then yes. Although it does, in terms of who they may be trading with, then there needs to be restricted individuals in contact with others. But in terms of if they're working and packaging things or something in a larger premise, but it's on their property and they're on the household, then it's my understanding that that's okay.
Would they be allowed to have the 2 sort of extra workers on top of that, or is that kind of encapsulated in the family group?
I think I might throw to the Chief Minister on that one. He may have more clarity than I do at this stage.
I had some questions for the Chief Minister, unless my colleagues have any more for the Doctor.
Great, thanks so much.
Thank you, Doctor.
Hi. So just on that question I had around sort of a family living on their property, but it doubles as their business, so say like a warehouse, are they allowed to have 2 additional workers come in to support them?
I wouldn't have thought so under the public health directions. We'll get absolute clarity on that, but I would not have thought so.
Chief Minister, the opposition's called for a clearer plan for businesses going forward. They want to see dates set for when those restrictions that you've outlined in the last few days might occur. They point out that most businesses would understand that these plans don't need to be set in stone, and that if the situation deteriorates, they need to be amended. Will you make a commitment to set some dates to give more certainty for businesses?
As we work through the next 2 weeks up to the next checkpoint, and then towards the end of the scheduled end of the lockdown on 15 October, we will provide further information, yes.
And on the announcement of community support package today, it seems a lot of those measures were perhaps already in the works before this current outbreak. Was that the case? Is it an acknowledgement that some of these sectors were underfunded?
Well, we were delivering a budget on the 31st of August prior to the outbreak, and so some of these measures were part of that budget process. We've of course had to go back and supplement in particular areas related to the COVID response. For example, decisions on community sector indexation are influenced by decisions of the Fair Work Australia body in terms of what that rate would be. It's also influenced by the Consumer Price Index and the Wage Price Index. It's a composite rate. So in some instances, decisions already taken. In others, decisions that have been modified to reflect the pandemic circumstances, and then others are new initiatives associated with the pandemic response.
You said yesterday that you will take modelling on the ACT's ICU capacity and the impact of New South Wales cases to National Cabinet on Friday. Just wondering, will that be made public?
Well, that will ultimately be a National Cabinet decision in relation to the totality of that work. I would expect it would. The question, I can't make decisions on behalf of New South Wales, though, so I can't release their capacity information. But presuming that National Cabinet is satisfied with the paper that's being presented by the Federal Health Secretary Brendan Murphy, and that covers all of the circumstances and scenarios that the Australian health system might face, and it's fit for release, and it's been signed off by all governments, then I would presume it would be, yes.
And finally, are you still confident you can get this outbreak back down to zero?
Well, it's the same question I've been asked basically every press conference or every second press conference. We face, like every jurisdiction, great challenges in suppressing a highly infectious virus. We have in place policy settings that are keeping our case numbers very low, but there are still new cases and new cases infectious in the community. I'm absolutely certain that if we ended our lockdown today, then we would, in the space of a week, have hundreds and hundreds of new cases that would quickly become thousands, and we would have hundreds and hundreds of people in hospital, and hundreds of people potentially needing intensive care. So I know what the other scenario looks like, very certain of that because we've seen it play out in Sydney. I am less certain because I don't control the virus. I don't have the ability to just click my fingers and have the virus go away. This is a global pandemic, and it's not under the control of any one jurisdiction, any one politician. But what I can say is that we are doing our very best to keep case numbers as low as possible, and we have the policy settings in place to stop an outrageous exponential increase that would rip through the unvaccinated in our community. We will not let that happen. We will just not let that happen.
The ACT Human Rights Commissioner wants an Assembly Select Committee reconvened to examine the government's response to the current outbreak. Do you think that's necessary?
Yes, we will be supporting a reconvened COVID Select Committee. The committee would have one representative from each political party, Labor, Liberal and Green. We would propose it be chaired by the Liberal Party so that the opposition party has the capacity to ask questions. We will put in place the same arrangements that applied to a similar committee in the 9th Legislative Assembly. The purpose of this committee is to seek information and to ask questions. That is appropriate, but it can't interfere with the policy response and the day-to-day operations of the public health team and government. So there are some caveats around when hearings can occur. When I'm in National Cabinet, for example, I'm not available to attend a COVID Select Committee hearing. Equally, when I'm chairing the multiple Cabinet meetings that the ACT government has each week, often 2 meetings a day, we're not available. I do not want the Chief Health Officer's valuable time being spent in front of committees. She will appear, and the cycle of appearance is likely to be once a fortnight for about an hour. Of course, the committee will hear from a range of ministers and a range of different areas of government, but it's an important accountability measure, but equally it cannot be a reason to drag senior public health officials and senior government ministers away from the number one task, which is responding to this pandemic.
Chief Minister, the opposition's also called for a business recovery task force. Is that something you would consider?
We've already established one.
There is one established?
Yes, we've been working with the Canberra Economic Recovery Advisory Group that has representatives of business organisations as well as leading public policy experts, small business representatives. That group has been in place for some time.
Okay. And businesses and people are asking, or wanting to be reassured that there's an end point to this. Is that something you can give now?
Oh, well, I'd love to be able to say, yep, everything will all be good for the rest of our lives on this planet, but I can't give those sorts of guarantees. This is not something that politicians can give guarantees on. This is a global pandemic that's into its second wave in the ACT, its third wave in some parts of Australia, and continues to rage around the globe. We will see new variants of COVID emerge. I think Africa has a 3% vaccination rate and 17 new variants emerging across that continent. So this is tough. This is not easy, and this is not something that a state premier or chief minister can give guarantees on. I don't want to be in this situation. No one does. But we are dealing with a deadly and highly infectious virus that is circling the globe and wreaking havoc on society everywhere around the world, causing unprecedented levels of serious illness, death and despair. It's a really hard time for everyone at the moment. But it's not just Canberra, it's not just ACT, New South Wales and Victoria, it's not just Australia. This is a global challenge. It's not the first time the world has experienced these sorts of pandemics, and I'm afraid it won't be the last.
Just one more about the support package today. A fair chunk of it is for the homeless, or services for the homeless. Is this an opportunity with the pandemic and what have you for the government to do more about homelessness in the ACT than they've done before? Is it an effort to get people off our streets?
Well, I think all governments around Australia, particularly at the state and territory level, are being asked to do more and need to do more. We, for example, have the highest proportion of public housing per capita of any state or territory in Australia. We always have, and I suspect we always will. There are many challenges in a society that is not equal. We have huge amounts of wealth in some parts of this country. We have national housing policies that prefer to give big tax concessions to property investors ahead of housing the homeless. That's the nature of Australian housing policy. It has been for generations. That issue, though, was pretty conclusively resolved at 2 federal elections in 2016 and 2019, where an alternative policy framework was put forward, but Australians didn't vote for it. So that's the situation that we find ourselves in at a national level. But we'll always advocate for more to be spent by the Australian government in partnership with states and territories on increasing social housing in Australia and doing more through programs like Commonwealth Rent Assistance and support for homelessness service providers through Commonwealth state housing agreements in order to see more resources applied in this area. But it's a challenge for every state and territory. But no government spends more than the ACT government does on a per capita basis in terms of its public housing, its social and community housing responses, homelessness responses as a totality, we do more than the other states and territories on a per capita basis.
On that topic, Chief Minister, the unemployment rate, we probably won't know the full impact, I guess, of this outbreak until we see those numbers from September. But is this an acknowledgement perhaps that you're expecting there to be a big hit and for those services to be under pressure substantially in the last quarter of this year as a result?
Well, look, I think the Commonwealth disaster support payments provide a reasonable level of tax-free assistance at $750, which, I mean, look, I've only seen some indicative reports coming out of the banking sector that indicate that the amount of household income going into bank accounts of households is holding up during this period. So the Commonwealth income supports have kicked in to provide a safety net. And depending on the circumstance of an individual household, $750 a week tax-free might actually be a little bit more than some households or some individual workers were earning in, for example, retail or hospitality, depending on the nature of their employment, the number of hours, etc. But there will be other people for whom $750 a week tax-free is less than what they were receiving in take-home pay earlier. The difference this time around is that the Commonwealth disaster payments, the way they're being provided, that's different from JobKeeper last year, severs the direct employment relationship between a worker and a business. JobKeeper kept the worker attached to the business. That was one of the strengths of that program. What you see now is that in order for a worker, an employee, to be eligible for the Commonwealth disaster payments, they have to have been stood down effectively by their employer. So the labour market will respond in a different way this time. You'll see a bit of a disconnect. Some industry sectors, particularly hospitality and tourism, are rightly worried that with that employment connection severed, that they might have difficulties in finding workers when things reopen. I mean, it sort of shows how quickly things can change, but only several months ago, the major issue being raised by the hospitality sector and tourism was they couldn't find enough workers to meet the jobs that they had. Now, they say economics is a dismal science, and this is an example where we've gone from a situation where there was a shortage of workers in those industries to a situation now where, because of an absence of any demand in those industries, all of the workers in those industries have largely had to be furloughed and are now on a support payment. It's difficult to predict how quickly the rebound will occur, but I am confident that there will be a strong rebound, and it is possible that at a press conference in 6 months' time, you'll be back asking me where we're going to get the workers we need for hospitality and tourism. That could happen.
For those businesses, the extension of these business support grants and the additional one-off top-ups you've spoken about, the businesses I've spoken to, they are all grateful for these, but as I think you've acknowledged a number of times, I mean, this only keeps their head above water. Is the well dry when it comes to supports for businesses? Are you anticipating you'll have to give further supports to businesses, or are you hopeful that when those restrictions ease, the needs for those supports will dissipate?
I hope there will be a further round of business support jointly funded between the ACT and the Commonwealth for the 2-week period, the first 2 weeks of October. I think in the announcement today on tourism, accommodation, arts, events, hospitality, that we've now got support that can run through the rest of this calendar year for businesses in that area. We have extended a range of commercial tenancy supports, doubled the value and extended the time period through to 31 December this year. All of this is predicated on a view that economic activity will gradually increase through the second half of October, pick up pace in November, and then what we all want is a very strong December, Christmas and summer holiday period where we see businesses able to restore their balance sheets, demand returning, in a number of industry sectors. I think we would all love that outcome, what economists would refer to as a V-shaped recovery. I think judging by Canberrans' response last time we came out of lockdown, there'll be a lot of pent-up demand, a lot of people wanting to access hospitality services, for example. I think when the pubs reopen, there'll be plenty of people wanting to go for a beer. Thank you.